This is IV checkoff. Hello, how are you? My name is Catherine. I'm going to be inserting an IV in you today. It should take 5 to 10 minutes. Could you please confirm for me your name and date of birth? He says yes, and he confirms. Then it matches his IV bracelet. So I say, do you have any allergies? And he says no. I say, okay. I'm going to perform some hand hygiene because we want our hands to be nice and clean. Hand hygiene. Mr. Jones, are you experiencing any pain today? He says no. If he said yes, we would administer what was already prescribed and then assess the patients in 30 minutes. Okay, we're ready to get started. Now I have a sterile IV kit here that I'm just opening. I'm going to take the tourniquet. I've placed a pad under the patient's arm. I'm going to take a tourniquet, put it in the most distal vein here. Okay. I'm going to take some alcohol. So you might feel a little stick in a second. I'm just going to clean the area there. Okay, wait for that to dry. Okay, this has come out of the sterile package that was laying here. I'm inspecting the tip just to make sure that the bevel is good. And so we're going to insert this bevel up. Hold it by the thumb and the forefinger. Okay, Mr. Jones, you're gonna feel a little stick. You ready? I'll do it at a 30 to 45 degree angle. Once you see that you have flashback there, you just remove that like that. Okay. Then you're gonna take your film that's unopened. You place it over the patient's arm, but not over the hub, just like that. You want the port sticking out so that you can actually put something in it. Then you're going to take your IV tubing, which is sterile, out of the package, and you will attach it like so. And you're going to want to flush, make sure there's no air before you get started, no air bubbles. And then finally you flush, 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 flush. Make sure you get some flashback. Okay, Mr. Jones, we're almost done. You can remove that. Set that aside. You're going to want to label it, when you did it, who did it. Put that right on the side right there so they know when to change it, or you know when to change it. You might want to secure with a little bit of tape just for some extra security. Probably want to put the tape over the label to make sure it doesn't get blurry or anything like that, you know, like from moisture or something like that, so it's still readable. And then secure also the little port there. Now, I've loosened his tourniquet, but I'm going to take it completely off now. Okay. Okay, Mr. Jones, we're all done. is there anything else that I can do for you? He says no. Say, okay, I'm going to raise the side rails of your bed. I'm going to put your head down as far as what's comfortable for him. I'm going to document everything, because remember, if you don't document, it didn't happen. Make sure that he has his call light. Has his call light within reach. I'll say, okay, I'll be back to check on you later.